Hello, everyone. Thank you for joining us today. Today's Cancer Care virtual seminar topic is grief and loss. My name is Annie Gebbe. I'm an outreach coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator today. This event is brought to you by the Samaritan Cancer Resource Center. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Joining us today is Heather Perue. Heather is a social worker with the Samaritan Cancer Program, and we're so happy to have her here with us today. Heather, thank you as well for being flexible and joining us over at Teams today. And we're so excited to learn more about this topic and finding out ways to cope. So thank you so much. I'll go ahead and turn it over to you.
Thank you so much for having me today. I'm really excited to talk about this topic, and hopefully in the end it won't feel like such a difficult topic to digest and participate in. So the definition of grief is deep sorrow, especially that's caused by someone's death. Now, there are certainly levels of grief that don't involve death. It could be ending of relationships or friendships that could also feel like it's a death, even though there's no official death. But the official definition is deep sorrow connected to someone's death. There's actually a French word that also describes this word grief. And it is called to burden. So the idea that losing someone causes someone to feel burdened is another kind of thing to think about. We want to explore the difference between grief and mourning, because I think those things are also two different entities. So the idea is that grief is what we experience inside, when we experience loss. Feelings like fear, loneliness, panic or yearning, or emptiness and anxiety are all feelings that we might feel when we're experiencing grief. Mourning, on the other hand, is the outward expression of those thoughts and feelings. So what does that look like for us to mourn and express those feelings? The other thing is that when we think about grief, there are times that maybe we thought grief has some sort of like end date. Maybe we won't be thinking of our loved ones so much and be impacted emotionally when we think about their passing. But there is no timeline for grief. Although the initial response to grief is generally 6 to 8 weeks or so, debilitating grief can last around 6 months. This is where people feel like they can't function and get back to their everyday, day-to-day life. So there's no end date, and grief can be short-lived or it can last a lifetime. There's a level that grief disrupts everyday functioning, and that varies person to person. There are people in my own family that have lost a loved one, and years later, they were thinking about that person's death. And so it looks different, and we're going to explore what that all looks like today. So I have an interesting photo on the next slide that I want to share with you. And I saw this picture and I thought, wow, this really describes grief very well. So grief is like glitter. You can throw a handful of it in the air, and when you try and clean it up, you'll never get it all. Even long after the event, you'll still find glitter tucked in the corners. It'll always be there somewhere. I've often thought about like parties and things that I've thrown, and even a year later, I'd find that like kind of, I don't know, the tissue paper type confetti, and I thought, how did I miss that? That party happened a year ago, but there it is, and it's a reminder of what that experience was. And so grief is similar to that. We find it in the nooks and crannies of our lives. Something that we experience will bring up a reminder of grief. Okay, I want to spend the next few minutes talking about the stages of grief. So you may be familiar with the 5 stages of grief. This is very known, 5 stages of grief. It was initially penned in the 1960s by a woman named Elizabeth Kubler-Ross. However, since then, there's been 2 additional stages added to it. The stages aren't linear. life experiences can bring up a certain stage of grief that you may have already worked through. And grief is fluid. So we can go in and out of different stages. So don't think that you're going to go through, all the stages. Okay, I went through the first one, now onto the second one. They kind of ebb and flow, and sometimes they are shocking when you experience a new, different stage. So it might feel like, in our minds, we kind of like to categorize things, like we're just going to check off the list, 1, 2, 3, 4, 5, whatever. But if there is this fluidity to grief, we might feel like that's out of control. Not only are we dealing with the loss of our loved one, but now we're dealing with this uncertainty and lack of awareness of like how we're feeling or what stage we're in or what's happening. And that can feel like this experience of grieving is very out of control. So let's take a few minutes to talk about it. So I did say that there were 5 initially. There are now 7 stages of grief. The first one is actually an additional to the original 5. So the first one is shock. That wasn't one that was initially identified in the 1960s. So shock in people often appear when people are just kind of going about their everyday life like nothing ever happened. There's no emotion to receiving the news of the death of a loved one or news of maybe an illness that could be life-ending. In my world, I deal with cancer patients, of course, and so we see this a lot when patients get diagnosed with cancer. There's this level of shock of, I'm going to continue to live my life and pretend like this is not happening. I'm not emotionally impacted by receiving this horrible news. So sometimes it takes a little bit of time for this initial shock of news to sink in. We hear this when, when people pass away and they receive the news and they go, I just saw them yesterday, or I just saw them last week. I can't believe that they're gone. We experience it when you think, oh, I'm going to pick up the phone and call them. And then you realize like they're not going to answer. This level of shock of going through normal things and not really taking in the fact that that person isn't there. We also can see numbness as a self-protective way of dealing with the shock and the grief of losing someone. So second step, denial, of course. So you know that something has happened, but it doesn't feel real. And denial can feel like mental fog. It could feel like forgetfulness, lack of concentration, sleeplessness, lack of motivation, repetitive thoughts, and the inability to make decisions where you just don't, if you're thinking about having to deal with funerals or things like that, sometimes you just, I can't make a decision of what's going to happen here if that person hadn't set those things up yet. You can also have thoughts about like, why can't that person not be here right now? That's also very common. When receiving a cancer diagnosis, denying the reality is also very, very common, as the diagnosis is very disruptive to everyday life plans. So you're planning on doing all of these things in your life, and then all of a sudden this cancer diagnosis hits you, and pretending like that isn't there and denying that you don't have that diagnosis is a very real and common stage that we see patients go through. The third stage is anger. People often try and keep this stage of grief hidden. It's interesting to think about as we are getting more familiar with expressing emotions in our society, how anger is one that we very much tone down. And if we are expressing anger, it could be very minimized by other people. So people experiencing anger are often encouraged by others to be further along in their grieving process, and they can also feel angry with themselves for not being where they think they should be within this process as well. So somebody's grieving, like we said, maybe it's 6 to 8 weeks. Okay, 6 to 8 weeks is a normal range for grieving. And if you're at the 8 weeks and you're still very debilitative, having grief, maybe you're thinking, I shouldn't be here in my grieving process. Or maybe you're talking to another family member and they're like, why can't you get over this? Being angry about having some sort of expectation of where you think you should be or where somebody thinks you should be with grieving often happens at this stage. When experiencing cancer, someone might ask, why me? I've done everything right. This anger or righteous anger might come out during this time as well. The fourth step is bargaining. It's making promises to yourself or a higher being, asking the universe for a chance to put things right. And a person might be seeking reason when there is none. They might feel guilty about how they behaved or feel like they're the one to blame. So around grief, they might feel responsible for the passing of that person. They might feel like if I just had one more day with that person, this bargaining of trying to reclaim something that is not there. It's important to avoid the shoulda, coulda, woulda, what ifs. What if I would have just said, don't get in the car? What if I would have all of this stuff? That thought process is actually just a whirlwind, right? And catching yourself is actually really important in this phase because of the next step that we're going to get to here in a second. At the stage of bargaining, a person may feel very helpless and hopeless. And while going through a cancer experience, a person may make statements or imagine how things might be different if the cancer was caught earlier, or if there was less time between recognizing symptoms and the first cancer treatment. If only I could have seen the doctors 2 months earlier, or if only my PCP would have completed the referral sooner. This level of bargaining happens, and we see it very often in our clinics. This is normal. This is a normal thing for us to experience. So number 5, remember what I said about the coulda, shoulda, woulda thing and the cycle of your mind and thinking I could have done this in the way of bargaining. That actually leads to step 5, and that's depression. They might be accompanied by isolation, anxiety, feeling of dread or suffering that is just too much to bear. Questioning the meaning of life or wanting to be reunited with a deceased loved one is also very, very common here. While going through the cancer experience, a person may feel deep sadness that impacts their everyday activities. They may consider things that are missing out, that they might be missing out on by being at doctor's visits, getting scans, tests, or sitting in infusion chairs. Feeling ill from treatment and facing sadness or depression is also a very tricky experience. Improving your mood isn't just something that you can decide to do when you feel like you're fatigued and in pain. It's not something that you can pull yourself up by your bootstraps to make yourself feel better while you're going through this experience. And it is crucial in this stage to ask for help. If you're feeling depressed, if your mind is spiraling with all of these things that are keeping you from being able to enjoy the things that you're able to enjoy during this experience, then ask for help. There are lots of people around that would love to be able to help you through this time. The 6th stage of grief is acceptance and hope. Humans by nature are community-driven beings. They crave contact, connection, and support. And at this point, there might be a turning towards reconnecting with family and friends. Acceptance comes when you realize that you can't change the situation and the circumstance, but you can gain some kind of control about how you respond to it. Be aware that this is also the stage that you could become so overwhelmed with emotions once again. So you're going back to those original stages. Right when you feel like, okay, things are going okay, you might just be hit by another wave and right back to one of those more difficult stages. But there is hope, and that life will go on. Finding acceptance and hope while experiencing cancer treatments includes finding peace with your diagnosis and focusing your attention and energy towards fighting the disease. So the 7th step of grief is actually the 2nd addition to the 5. Excuse me. So processing grief is individualized, and has no right or wrong way of doing so. There's also no quick fix. It's a process and it takes time and intentionality. Find time and mental bandwidth to actually think it through and come to terms with your experience. Don't try and avoid. Often, after cancer treatments are long gone, reflecting on the experience can be quite overwhelming. Spend time processing your experience. I have a poem on the next slide that I want to read to you. It says, I had my own notions of grief. I thought it was a sad time that followed the death of someone you love, and you had to push through it to get to the other side. But I'm learning there is no other side. There's no pushing through, but rather there is absorption, acceptance. Grief is not something you complete, but rather you endure. Grief is not a task to finish and to move on, but an element of yourself, an alteration of your being, a new way of seeing, a new definition of self. That was written by Gwen Flowers. I want to talk about cumulative grief really quick, which sometimes feels a little bit overwhelming, but there's this idea of grief across the lifespan. And when it comes to experiencing a current grief, if previous losses haven't been dealt with, it will create a backdrop that impedes the coping of any new losses. So the statement of grief upon grief upon grief upon grief often comes up here. When the loss of something current will cause a person to unconsciously think of someone who was lost prior, even if it was many years ago. So here's the other interesting thing about grief and why we do this as humans is that grief itself can be found on medical exams. There's a particular part of your brain called the hypothalamic pituitary adrenal axis. It's the HPA. You can do an HPA test. And you could also look at functional MRI. So it's not just like pictures of your brain, but it's like videos of how your brain is working and functioning. And you can actually see videos and there are actually traces of grief inside your body. So if all of a sudden you're experiencing grief, and it's something that you experienced years ago with a loss of a loved one or someone close to you, it is very natural for your body to remember that and for your body to think about that first person that had passed away. Our bodies are magnificent beings. And it's very cool that science can now see that in how we're working. Consider your assumptive world. This is a very interesting thing to think about. So assumptive worlds, your assumptive world is assumptions and beliefs about how the world works. And there are a person's fundamental meanings for life. They secure, stabilize, and orient people to everyday functioning. And in essence, they're your core beliefs. A thought that death and trauma violate and trigger this grief is a common thing. Those core beliefs are shattered and lead to fundamental disorientation. So let me give you a couple of examples of that to make sense. So this idea that children outlive their parents. So if you are a person that have experienced the loss of a child, this could shatter your belief about children outlive their parents. Or this thought of maybe, we're talking about a couple and maybe one has very ill health and unexpectedly the person that is healthy passes away. So this thought of like, you would outlive your spouse or your spouse would outlive you. This is a fundamental belief that this would happen. We also have other fundamental beliefs that are in our culture, like a family structure. So you would be married with 2 kids, a car, and a white picket fence. I'm not quite sure the white picket fence is still one of those common beliefs, but it's very well known as well. And so if all of a sudden your assumptive world does not match up with that, then this could cause some pretty intense destabilization and disorientation for a person. Another thing that comes up with me when I'm speaking to patients is that their hopes and dreams about retirement and what that would look like have been crushed by their partner or themselves receiving a cancer diagnosis. That could be very disruptive to them. I want to read another story, and this has personally, I read this actually years ago around the death of someone in my family, and I feel like it really can explain the process of grief and how there are times when you're dealing with grief really well, or you're feeling very overwhelmed with it, and how the hard pieces of grief sort of stretch out over time. So it is going to be on the screen for you, but I'm also going to read it. So as for grief, you'll find it comes in waves. When the ship is first wrecked, you're drowning with wreckage. It's all around you. Everything floating around you reminds you of the beauty and the magnificence of the ship that was and is no more, and all you could do is float. You find some piece of the wreckage and hang on to it for a while. Maybe it's some physical thing, maybe it's a happy memory or a photograph, maybe it's a person who is also floating. And for a while, all you can do is stay afloat and to stay alive. In the beginning, the waves are 100 feet tall and crash over you with no mercy, and they come 10 seconds apart and don't even give you time to catch your breath. All you could do is hang on and float. And after a while, maybe weeks, maybe months, you'll find the waves are still 100 feet tall, but they come further apart. And when they come, they still crash over you and wipe you out. And in between, you can breathe and you can function. And you never know what's going to trigger grief. It might be a song or a picture, a street intersection, the smell of a cup of coffee, and it can be just about anything. And the wave comes crashing. But in between waves, there is life. Somewhere down the line, and it's different for everyone, you find that the waves are only 80 feet tall or 50 feet tall. And while they still come, and they come further apart, you can see them coming, an anniversary, a birthday, or Christmas, or landing in O'Hare. You can see it coming, and for the most part, you prepare yourself. And when it washes over you, you know that somehow you will, again, come out the other side. Soaking wet, of course, sputtering, still hanging on to some tiny piece of the wreckage, but you'll come out. Take it from an old guy, the waves never stop coming, and somehow you don't really want them to, but you learn that you'll survive them. And other waves will come and you'll survive them too. If you're lucky, you'll have lots of scars and lots of love and lots of shipwrecks. So I want to shift a little bit from kind of talking about the fundamental pieces of grief and what it looks like to actually coping with it. And this is where I get excited because it gives us tools for what to do. So I'm going to talk about 10 tips, and we're going to go through each one of them. So the first one, remember to celebrate. The life of your loved one or your life, celebrate it. It can be an ongoing experience, but live it out. Do it. Number 2, acknowledge your feelings. Facing your feelings by naming them and dealing with them. If you can't name them, then have somebody help you name them. Being able to name them is very, very powerful, and it helps you feel like there's some sort of control over the thing that you're feeling. Find safe people to help you shoulder those feelings and provide comfort to you. Number 3, take care of yourself. Be intentional about sleep and rest. Physical health, staying connected to others, eating, drinking your water. If you haven't drank your water this morning, it's afternoon and gonna be hot. Drink your water. Avoid alcohol, drugs, and cigarettes. Protect your energy. Schedule difficult tasks around times of day where you could perform your best. I'd also like to add, if there are people in your life that require you to give more energy and you don't have that energy to give, it's okay to set boundaries around them as well. Participate in activities that bring you joy, support your mental health, and encourage healthy living. Okay, number 4, maintain a healthy diet. Concerning mental health and physical symptoms, they can worsen with poor food choices, so make good choices. As for help ask for help while going through cancer treatment. If you're connected to the Samaritan Cancer Program, we have dietitians that are amazing to help you with your diet. That's my plug for them. They're wonderful assets to us. Number 5, move your body. Right now we have walking groups in 2 of our locations, and it gives you at least one opportunity a week, depending on what site you're in, to move your body, but try and move your body. It is a tool for coping with overwhelming feelings, thoughts, and movements. It's really great. Number 6, understand that grief is unpredictable. Our story that I just read explained how sometimes you are just not expecting the next wave of grief. And grief can feel like you're being tossed around with the tides. So understand that this is okay if you are all of a sudden overwhelmed with thoughts of grief. Number 7, be patient with yourself. Practice self-compassion. Remember that there's no shortcut through grief. The only timeline is the one that you create for yourself, and know that any timeline is normal, whichever one you pick. Number 8, reach out to others also dealing with loss. You're not alone. Talking to others can help you recognize how normal your experience is. Number 9, seek out supports, natural or formal supports, whatever that looks like. If a neighbor has experienced grief, that's great. If you need more professional help, that is okay as well. Evaluate your support system and ask for help in ways that they can show up for you. And number 10, accept your new reality. Find a sense of meaning, find new priorities, and evaluate what's important. Here's another grief quote for you. The only cure for grief is to grieve. So try not to avoid it. Let's work through it because it's the only way through it. I want to talk a little bit about self-care and self-compassion for just a few minutes. So I want you to think about how you can include the following steps and tricks into your life, and consider it as like adding a new tool to your tool belt. Sorry, my phone just went off. So examples of self-care: eating healthy, we already mentioned. Oh, go back. Eating healthy, exercising, of course, going for a walk, drinking your water, getting enough sleep, taking a bath, nurturing or fostering healthy relationships, and getting professional support when you need it. Self-care isn't just me time or pampering or massages, although that could be a form of self-care. Self-care is also not just about feeling good. Some forms of healthcare or self-care, like going for a walk or exercising, don't actually feel very enjoyable in the moments. Or eating your broccoli isn't that enjoyable. I'd rather have a taco, but you're doing it because you know that it's good for you and you will feel good after you get done doing those things. Self-care is about doing something to improve the quality of your life by bringing balance, meaning, purpose, and fulfillment. Self-care can also be forgiving mistakes that you made in the past or forgiving others that you've held a grudge against. Setting boundaries in relationships is a form of self-care. Getting an extra hour of sleep is a form of self-care. Making a medical appointment that maybe you've been putting off, like maybe going to the dentist, drinking your water, or quitting a stressful job, or ending a relationship. Those are all forms of self-care. And so sometimes we think, self-care is only the pampering, or I'm going to get my nails done or whatever, but it's also being intentional about what you let into your life. Self-care is also self-compassion, something that we're often not good at. Self-compassion is defined as giving yourself the same compassion you'd give to others. And that means in order to have self-compassion, you need to notice that you're suffering when you need to feel moved by that suffering. Self-compassion is extending compassion to oneself in instances of perceived inadequacy, failure, or general suffering. So here's a couple examples. I'm going to be kind to myself. It's okay to make mistakes and forgive myself. Change is never simple, and it's easier if I stop being hard on myself. I'm going to do the best that I can in this moment, or I'm going to be okay even when I'm not okay. I want to talk about positive thinking next. So there's a couple health benefits, well, more than a couple health benefits of positive thinking. Awesome. It's interesting on this slide, it looks like it's like a strikeout, but that's not the case. So there are some health benefits of positive thinking. It can increase your lifespan, can lower rates of depression, can lower levels of distress. We have a greater resistance to the common cold, interestingly enough. We have better psychological and physical well-being. We have a reduced risk of death from cardiovascular disease, and we have better coping skills during hardships and times of stress. So practice your positive thinking. Let's also talk about gratitude. So psychologists discovered that when a person expresses gratitude, it contributes to their overall happiness and well-being. Gratitude is recognized by appreciation and readiness to return kindness to others in a pay-it-forward style. Practicing gratitude can also improve sleep, give and receive emotional support, and increase the likelihood of being physically active, interestingly enough. But gratitude isn't just about being thankful. Simply giving thanks is a watered-down version of the act of expressing gratitude. All of those wonderful benefits of expressing gratitude will not be seen at this level of practice. It's not just a thanks. Participating in gratitude has additional levels of complexity that includes recognizing and lamenting over the things that were lost in order to fully appreciate the things that we now have or we possess. To fully lean into the practice of gratitude requires the intentional ways we're stewards of the pieces that we're grateful for. It's not just a moment of thanks, but a continual acknowledgement of the gifts that we currently possess and how we're honoring them in our lives. When lived out in this way, result of true gratitude and all of the amazing personal benefits will happen. I want to talk about hope now. Hope is an optimistic state of mind that is based on the expectation of positive outcomes with respect to events and circumstances in one's life or in the world at large. Hope physically is just survival, right? This question of, are we going to make it through this? And if the answer is maybe, then there's hope. There's a chance, even if it's small, that we're going to make it through. Hope is to cherish a desire with anticipation, a feeling of trust, a desire with expectation or obtainment, or believing good things will happen with faith, looking on the bright side and seeing changes as opportunities for new experiences or new adventures. Hope reduces feelings of helplessness, increases happiness, reduces stress, and improves quality of life. The power of hope comes from the belief that our future can be better than the past, that we have a role to play in making that reality, that future become a reality. It's focused on goals, pathways, and willpower to make it all happen. I want to read you another quote. It says, and then one day we discover we're all healing. We find we have room to hold both hope, hurt and hope. Okay. I want to give a plug to the Cancer Resource Center really quick on the next slide. I know that Annie showed a picture of both of the Cancer Resource Center buildings. So we have one in Corvallis and one in Albany. But I absolutely love the resources that the Cancer Resource Center offers to us. Not only are these webinars part of the resources that they offer, but we also have really cool programs like That's My Farmer, which is a 5-week program that we did over the summer around food and wellness, going to your local farmers market. They have topical studies that they do based on the months and how to focus on screenings and awareness, things like that. They also offer groups. And so if you are a person that is experiencing cancer, has experienced cancer, there are groups available for you. Most of them currently are virtual. A couple of them are in person. There are seasonal activities that are going on. There's daffodils that are, passed out, all kinds of fun stuff as remembrance. Both of the resource centers have a library as well. So if you are interested in reading up about all things cancer, how to cope with it, recipes and things like that, they have all kinds of information that you can, loan the book and borrow it and read it, check it out. The other thing that they offer are wig fittings. If through your chemo experience you've lost your hair, there's wig fittings and also some funds to be able to help with that. We have beanies that we pass out in the winter time to cover your head. Lotions, they have partnered with a company that has specialized in lotion specific with folks that are getting cancer treatments to be able to help with their skincare needs. All sorts of other things available to them. Someone to talk to you over there. They have a social media account. If you haven't been on their social media account, hop over and see that. They have all sorts of really great resources there. So reach out to the gals over at the Cancer Resource Center, depending on what location you're in, whichever is closer to you. They would love to be able to see you and be able to figure out how to help and support you through this experience. So anyways, that is what I have for you today. This is my contact information if you would like to get a hold of me, and I am available for questions or just kind of talking, whatever would make sense to you. I do cover the Lebanon and Albany oncology hematology clinics. But certainly if you are listening to this and want to reach out, I am also available to you. Email's on there as well if that works out better for you too. So thank you so much, everyone.
Thank you, Heather. I want to plug the social workers and all the wonderful work that you do. Thank you for mentioning all the great services we have at the Cancer Resource Center. I do want everyone to know that these are available to you. If you live in Lynn County, Benton County, out of the county, Lincoln County, if you have trouble accessing these resources physically, please call us. We can get them out to you by mail or drop them off, go to another office, the courier, anything. So please don't hesitate to reach out to us if you need help with anything, need resources. We're here and we're happy to help. It's our job and we also like doing it. So please take advantage of us. Let's see, let's move on to questions. Does anyone have any questions or comments? I'm not seeing any right now, but I'll leave a few moments open for anyone that wants to write in while I go over what we have going on. Here is our contact information. You can reach us by phone, the internet. You can go to our website or our social media, our email address. We also have a monthly newsletter that we send out the first week of the month to keep you updated on the latest services, any updates we have or events we have coming up. So please give us a call or reach out to us whatever way you prefer so we can let you know what we have going on. Our next events, we have Understanding Cancer with Dr. Davis next week on the 3rd, and the next portion of our Cancer and Sexual Health series on Thursday, the 11th. We will plan on doing these using GoToWebinar. Hopefully won't have any hiccups there, but we always have Teams as backup if needed. So please reach out to us if you're interested in registering for either or both of those. And I'll go back to questions. It doesn't look like we have any questions, but if any pop up, please give us a call. Heather also provided her information too if you wanted to reach out to her directly. Either way, we can field calls and comments and questions to her if needed. And I just wanted to thank everyone for coming out today to Teams after our technical issue. We really appreciate your flexibility and we hope to see you next time. There will not be a survey going out for this particular one today. We will attempt to send that out after we have access to GoToWebinar. Otherwise, you can go ahead and sign off, and I hope everyone has a good day. And thank you very much to Heather